different than other modality of the thermal ablation or chemotherapy or even the other treatment, as it's worked by different mechanism. Direct mechanism, which is the tissue destruction by thermal histotripsy and the microvascular disruption, and it's affecting very, very promising researchers now talking about the immunomodulation, how is the thermal effect of the HIFU and the cryo and nanoknife affecting the immunomodulation of the treatment. The technical theory of the HIFU is two targeting point from 12 to 16 centimeter away from the probe and reducing, providing thermal effect and coagulative necrosis. It's working by point, slice by slice, to introduce the power into the tumor. At the end, we make a 3D volume of the tumor. The patient is lying down, no need for movement, and we targeted it by 3D effect. We have two options, ultrasound guided and MR guided HIFU. And this platform showing the different application used for HIFU according to clinical use and research use. We have many applications in neurological FDA approved, like essential tremors, Parkinson's disease, and affecting the atherosclerotic disease. Musculoskeletal, it's FDA approved and C approved and used for back pain, osteoarthritis, osteoma, bone metastasis, and many other diseases. In the oncology, we have many applications of the HIFU outside USA and inside of USA. And this chart showing us what is the application of HIFU in everywhere. In North America, it's not appear here. In North America, the prostate, the bone metastasis, essential tremor, osteoma, Parkinson's disease, prostatic cancer, and uterine fibroid adenomyosis is approved as FDA approved application. In Europe and the rest of the world, it's applied in many diseases, and we are honored in Egypt as a part of this. And of course, there is a significant increase in the clinical use and publication related to HIFU. Regarding the number of patients treated by HIFU, we have a cumulative number. It's around 500,000 patients. 500,000 patients, 250,000 complaining from uterine fibroid and adenomyosis, and 250,000 patients treated from different diseases of the cancer. And this is increasing significantly throughout the past 3 years and 2 years, as only in the past year we have 100,000 patients treated by HIFU from different diseases. And of course, the increase of the publication. It's a significant increase of the publication. And the neurological usage of HIFU, especially in Parkinson's and essential tremor, now is FDA approved, and there is many centers around the world treating the patient from essential tremors and Parkinsonism. Of course, there is a small number of patients, around 10,000, but at the end of the story, this is a new hope for this patient. And the oncology intervention usage of HIFU is the most growing business in medical field, as the prostate cancer and pancreatic cancer, and after this, the liver cancer increasing. الفيديو ما بيشتغلش. ممكن نشغل الفيديو. Sorry, but this video is very important because it's showing us the safety, how we can target the point, very precise point, and we are very safe to put our hand and continuous treatment. Okay. The HIFU, of course, is a non-invisible, re-treatable, no ionizing radiation. There is a high safety profile, no need for hospitalization, and next day the patient returned to normal life. We must be oriented by the anatomy, the positioning of the patient, the surgical approaches in different disease, the direction of power and the physics of power, and we must start with the least power. This is a general rule. When we have a less distance, less vascularity, less size, we will get a better effect. This is the applied worldwide, FDA approved and practically in everywhere treatment. There is a benign tumors and malignant tumors. This is an ultrasound guided treatment. The technique is very simple. We just need very small accessories. We have a very wide range of application. As I'll show you, this paper is very important. It's a review literature about 10,000 patients enrolled in this study. This study shows that the HIFU is very effective in treatment of fibroid. The efficacy reach around 90%. The treatment time is 1.5 hours. And the ablation volume is about 80% of the tumor, and the improvement of the symptoms occurred significantly after 3 months. The tumor size will reduce up to half of the fibroid regarding to coagulative necrosis after 3 months, and will reduce after 2.5 years up to 20%. And this is an example of the case. This is a large fibroid, and after 8 months, this is almost disappeared. And of course, there is many diseases like adenomyosis, which in somehow you consider as a malignant disease, and very efficient. And this also a large old series talking about the different application of HIFU with very good result. Of course, we will face a big problem regarding the liver and the pancreatic cancer in the next decade. And the HIFU will play a very important role in the hepatobiliary tumors. And till now, the ultrasound-guided HIFU is considered the only remarkable treatable disease for the liver and pancreatic tumor. And of course, this is a group of Hong Kong University. This Hong Kong University, this is the best group now talking about the treatment of HCC. They compare the HIFU with radiofrequency with equal results and equal survival in 3 years survival. Another era regarding the immunotreatment and the effect of the ablative treatment in HIFU in pancreas. It's ultrasound, very effective in pain management, and in primary bone tumor, the new techniques talking about the ablation and immunotherapy and chemotherapy, and it's very efficient local ablation, no need for amputation. In bone metastasis, especially in around the pelvis, it's very efficient with new bone formation, reducing the pain. In difficult locations like chest wall, we can treat the tumors in the chest wall. I think this is the future, and it's approved now. It's HIFU is very efficient and ablative procedure, reducing the pain in bone metastasis. And talking now about the synergetic effect with ablative procedure with immunotherapy and chemotherapy, how this affecting on the thermal therapy will affect on the cell level, tissue level, and even its remote level will change the nature of the tumor and improve the quality of life of the patient. Now we're talking about a new era of what we call the abscopal effect. The abscopal effect that talking about if we ablate the original tumor, this will reduce the incidence of the metastasis and even affect the metastatic disease.
Do you need more time, Dr. Mohamed?
No.
Do you need more time?
Most of the years.
Okay.
This is what called abscopal effect and the immunotherapy, and this is very important for the future of the cancer treatment. Thank you very much.
Thank you very much, Professor Mohamed Hamid, my dear friend, for this illustrative and very nice presentation about the newly emerging but fastly growing HIFU technology.